moms, I'm Dr. Parul, and today I'm going to share some skincare tips for children less than 12 years of age. And you'll also understand why we need to change the patterns of skincare while the child goes ahead. Now, when the children are less than 3 years of age, the skin is about 30% lesser than that of the adult, and that is the reason they tend to lose lot of moisture to the environment, and they're more prone to dryness and flakiness. Second, the temperature regulating mechanism in these small babies is not yet formed. That is why you have to make an effort to make sure that the skin is warm during winters, it's cool during summers, and kept hydrated and protected all throughout the year. So you have to give them a gentle bath with lukewarm water with good gentle cleansers which are available for babies of that age. The markets are flooded with it. Make sure you buy a good brand, and all these good brands will have a specific property which I will also mention to you a little later. So these cleansers which you use for about 3 to 5 minutes of bath every time you put them into lukewarm water will have less surfactants, they'll be fragrance free, they'll be color free, they'll be paraben free, and they'll be very gentle. They will have very less lathering property, and that is what we want for the babies to have. Now, secondly, post that, put a good moisturizer after patting the baby's body. The moisturizers for the babies are also labeled as moisturizers for younger kids. It's packed with that label. You can pick up, and if you can see the ingredients, they will have aloe vera, it will have avocado oil, vitamin E oil, shea butter, olive oil, sunflower oil, and all of these. But just a small note of caution: if you just see that the product or the moisturizer which you are picking up just should not have paraben, should not have alcohol, and should be sulfate free. So if you see that these things are avoided in your product, that's best. Many of these good brands actually mention below paraben free, sulfate free, alcohol free. So if you can just see, you can always pick up a very good product. Now, once the child starts growing and starts going to the school, they have their own mind. When a child is a baby, it loves to play in water, for hours together. How much ever water you give, it just loves it. Once they start going to the school, they start refusing to have bath. You must have seen, they refuse to put water on their face, they refuse to wash their hands, they refuse to wash their hair. That is how they are. And plus, when they go to school, they are extensively into the sun, they are into dust, they are dirty, they are muddy, and all of that. But that's childhood, right? So at that age, beyond 3, you need to make sure that you are putting and inculcating good habits of hygiene at that age. So make sure they're washing their hands, washing their feet, washing their body, having bath again good 2 times in a day, washing their hair about 2 to 3 times a week, washing their face nicely when they come back, and again put a light moisturizer. In babies, I recommend little creamier moisturizers, while at this age, say about 3 to 10 years, you can start using a lighter moisturizer, but it is mandatory. Along with another product called as a sunscreen for kids. You can go in for 15 to 30 SPF. If they are going into school and they are into sports or swimming, then make sure you're putting a sunscreen all over the face and on the body on the exposed areas. And a good physical sunscreen containing zinc oxide is enough to take care of them when they are outdoors. Now, beyond when they are about from 10 to 12, the skin is undergoing a lot of hormonal changes. The puberty may be attained at that time, and you may see as early as 10 years that the skin starts getting oilier. So start using a good face wash in consultation with your doctor so that you do not fall into the blocked pores and the blackhead, whiteheads and the pimples as earlier as that. So start using a good face wash which will help to remove that extra sebum from the face. Along with the bath, they can use that. Also, when the face gets oily, the hair also gets oily. So the scalp also will secrete a lot of oil, so that use maybe in a week at least once an anti-dandruff shampoo, because sometimes you start feeling a little greasy and a stuck whitish dandruff like flakes. So it's always mandatory to wash them off cleanly, make sure there's no oil and no dandruff at that age. So add a good face wash when you're between 10 to 12. Of course, a sunscreen, if you're long hours into the sun, make sure sunscreen is used. Face wash, like I said, the drying ones, that would help. Now, another small tip I would like to add, when you have a baby in your house, you are also prone to getting diaper rash. Now, this diaper rash is nothing but the diaper and the sogginess in the groins leads to a lot of moisture retention and sogginess of the skin as well. Sometimes secondary bacterial and fungal infections do lead up over there. So make sure you're using a good diaper, changing it constantly, making sure that the area is dry and kept open for a long time. Make sure you use powders over there. Good diaper creams containing zinc oxide are also used to keep the area well. And if in case you have signs of infection or too much of redness, please go to the doctors or for an antibacterial medication. So another point which I would also like to have, now this all description was more for a normal skin, but what about children who have an atopic tendency? Atopic is a group of signs and symptoms in which the children are more on the allergic side. So the skins are allergic, their body is allergic, they have a lot of allergic rhinitis, they have a lot of sneezing, they have more bouts of cough and cold throughout the year, the skin is dry perpetually throughout the year, and they have a whole lot of red and dry flaky patches all over the body which keep recurring during the seasons. And in such cases you need to use a very gentle body wash. Secondly, the moisturizers are much thicker. So we give you moisturizers which have ceramides and thicker fatty acids, so that covers and contains the inflammation. Also, you will need cortisones, you will need anti-inflammatory medicines to put on the patch and to intake also. Secondly, immune boosters are given. So it's a different kind of disease and imbalance altogether, which the doctor will handle it for you. But these cases do arise and you will be able to detect them much earlier in age. If your child skin is extremely dry, if it's very sensitive, even to wool, even to if you apply something, change of weather, if an insect has bitten you or a mosquito has bitten you, and the child will be excessively scratching inproportionately, all of these signs are if you fall into an atopic or an allergic skin portfolio. So you can approach a doctor for that. So I hope today's all information was beneficial, and take care of your kids. Any other queries, we'll be happy to solve them. Thank you.